news right at your fingertips. Your most trusted source of news goes global, goes digital. Explore a world of options, top stories, live updates, in-depth analysis, and more. Stay informed wherever you are. Real-time alerts keep you ahead of the curve always. The DD India app, connecting you to the world one story at a time. Download now and explore the world of knowledge, insights, and authentic information.
Namaskar and welcome to our special program titled India Fights HIV and STI. We'll tackle this program in 2 episodes. In the first episode, we'll try and understand what HIV and other sexually transmitted infections are and how we are prone to them, how we can prevent them. In the second episode, we will look at the different government measures to tackle HIV and other STI. To talk us through this, help us to understand a lot more about sexually transmitted infections, HIV AIDS in particular, we have with us Dr. Shobini Rajan, who is the Deputy Director General at the National AIDS Control Organization. Thank you very much, Doctor, for being with us. So let's start at the very beginning in a sense. Is there any difference between HIV and AIDS? We keep using the 2 terms together. What is it actually? I mean, could you define for us what they mean?
HIV stands for human immunovirus, which is the name of the virus which causes the infection of HIV. AIDS stands for acquired immunodeficiency syndrome, and it refers to the complex of symptoms and symptomatologies that actually represent the culmination of the immunosuppression due to HIV infection. So, HIV is the name of the virus and the way we refer to the disease as well, and AIDS is the stage at which a person is fully immunosuppressed and manifests the immunosuppression.
So, do we always refer to them together or?
We refer to them together because per se a person does not die of just the HIV infection, he usually dies of a consequence of the immunosuppression. So, the terminology of HIV AIDS is how we refer to it globally as well as nationally.
How does a person get infected with HIV and how quickly does it spread in the body?
Okay. So, HIV as an infection has only 4 modes of transmission. The primary and the most important one being sexually transmitted, and sexually transmitted from an infected individual to his partner. This is the primary mode of transmission, and the sex could be homosexual or heterosexual. The second mode of transmission is through sharing injection equipment. So, basically from one infected injection needle or syringe, if it is used by multiple people, the infection can spread from one person to another. The third mode is from an infected mother to her baby, and this spread can happen during pregnancy, during childbirth, and even during the period of breastfeeding. And the fourth mode of transmission is if infected blood is transfused to a healthy individual, then the infection can go from through the mode of blood transfusion.
So, you've seemed to have outlined certain categories of people, but how serious is HIV? Is it a life-threatening infection?
We like to refer to HIV as a chronic manageable illness, akin to hypertension or akin to diabetes or things that can be managed. And this is because when initially the HIV infection came in, it did not have a cure and it also did not have any treatment. But now there are drugs which you can take lifelong, and using these drugs you can keep the level of your virus, HIV virus, to an undetectable level. And you can lead a very fruitful and healthy life, provided you continue to adhere to the medication and you are looking after yourself in terms of your diet, your nutrition, your exercise, and your overall well-being. So, we do not like to call it life-threatening. Having said that, HIV, because if it is untreated, it can lead to your immunity dipping and makes you susceptible to a large number of infections,
Yes.
most commonly tuberculosis, and this can lead to a person dying.
So HIV prevents us from, fighting or suppressing other illnesses as well, other diseases. And so the question is, how does one actually prevent HIV among the risk categories? Of course, this is a long answer, but if you could be brief.
Right. So HIV, knowing about HIV itself is the major mode of prevention, I would say, because the transmission happens only through these 4 routes. So in these 4 routes, if I kind of leave out the blood transfusion part, because that is not something a person chooses to do. It is if a person is sick and he is admitted to the hospital for an illness which requires transfusion, and there the system is taken care of by having licensed blood banks and ensuring that every transmitted unit of blood is, every transfused unit of blood is tested for all the infections.
Yes.
So there it is more the system. But for the other 3 modes of transmission, I'll tackle the pregnancy part first, where it is kind of, I wouldn't say mandatory, but it is part of standard of care that every pregnant woman undergo a test for HIV during the process of pregnancy. And an early detection of HIV during pregnancy can allow us to put the mother on antiretroviral treatment to prevent the transmission from this mother to the baby. And of course, the mother is also followed through during her pregnancy to see if her viral loads are suppressed, and also the baby is provided some drugs after being born. And by this whole cascade of testing for the baby till he is 18 months of age, we are able to achieve prevention of vertical transmission. Now, when we come to the crux of the matter, which is transmission through unsafe sex and transmission through use of, reuse of or sharing of needles and syringe and injection paraphernalia, the onus lies upon the individual. So now any individual who is putting himself at this kind of a risk by either having unsafe sex or by having a tendency to share needles and syringes needs to be fully aware of the modes of prevention also. So in the sexual part, I would say that we have condoms freely available at every chemist. They are of course also freely distributed in the health system, and having a consistent and correct use of condom during sex prevents the transmission of this infection. And for the drug use, I would say that youngsters these days need to be aware of the risk of drugs, because it doesn't start with injection. Drug use starts with perhaps a smoke or a drink, and then it goes on to perhaps using other intoxicants and then into injecting use. So injecting use is best avoided. People should steer clear of drugs. But having said that, if you are already on injecting practice, then you need to make sure that you do not share the needles and injection paraphernalia, and contact some provider to get yourself off the addiction.
Right. So if we stick to the drug addiction part, now people who get into drugs, get addicted, they are probably require counseling of a particular kind. They are probably unaware of various other aspects that they are prone to these kind of illnesses. How does one actually reach out to them?
Yeah. So drug users would not really come out into the open and say that I use drugs. But the health effects of use of drugs would drive them to the system. And if it is, let us say, use of intoxicants like alcohol or tobacco, the government runs de-addiction clinics in almost every government hospital where a person can come and access care. Now, in terms of injecting drug use, the numbers and the populations are very niche, and there are certain geographies of the country where these populations and the use of these drugs is predominant. So under the program, we have interventions which are run through either non-governmental organizations or through patient support groups to make sure that we provide harm reduction, as well as we provide good counseling, and we provide linkage to care by ensuring that all these populations are tested for HIV, hepatitis, STIs and other common infections, and if found positive, referred for appropriate care. And for prevention, we always address the fact that a person should first of all avoid getting into a situation like this.
Right.
But if he has already got into it, he should avail support. And here I'd like to also mention to all our viewers that the National AIDS Control Program runs a helpline called 1097. And this helpline is available across myriad languages, and it is toll free. So a person who is perhaps doubtful of what are the risks to do with getting into drugs or HIV, if he wants to know more information, can call this helpline and talk to our counselor and be directed to the appropriate resources that he may need.
So people usually, I mean, even now, it's probably still taboo to talk about HIV/AIDS, and it's not looked upon. You know, perhaps there is a stigma still attached. So people may be worried about suffering from discrimination. Also, how do HIV patients then, you know, how do people treat them with dignity? Because it's really an awareness for other people also, right? But it's also an awareness for the person who has this illness to be responsible, isn't it?
Exactly. So HIV is largely a silent disease. It's not something that community can make out by looking at a person to say that he or she is infected. So largely in the society, in the family, in let's say educational or workplaces, until and unless a person self-discloses himself to be HIV positive, people are not likely to come to know. So, but we do see, as you rightly said, a certain hesitancy in a person coming out with this information to his even immediate family or peers because of the discrimination or stigma that he is likely to face. And HIV, because of the sexual transmission, and also perhaps because of the kind of propaganda that happened when this disease initially came on the horizon, that people tend to look at a person who is HIV positive in a sort of discriminatory way because they may be judging his behavior, his or her behavior. Having said this, under the program and by the government of India, there is a law. There is the HIV AIDS Act and Rules of 2017, which provide a safeguard towards this kind of discriminatory behavior, which may occur at family, at community, or at workplaces, or anywhere, at educational institutions, etc., towards a person just because of his HIV status.
Right.
So any kind of discriminatory behavior or stigma
Is illegal.
Is not legal, and there is a certain punishment for this which is prescribed under the Act. And the program also provides a lot of I would say IEC material and advertising to normalize HIV and to encourage society to treat HIV positive individuals as any other, and not really look at them with that lens of judgment or discrimination. Not because it is illegal, because it is not necessary. HIV cannot transmit by sitting across the table with another person. It cannot be transmitted by eating together. It cannot be transmitted by shaking hands, to the extent it can't be transmitted even through kissing.
Okay.
So a person in social contact with an HIV positive individual need not really be scared of getting transmitted.
Is there a relationship between HIV and other sexually transmitted infections? And what is the support that the government gives for people who are suffering from other STIs?
So STIs are, I would say, biblical in nature. They did not come recently, and they've always been there. And STIs are also not limited to only one HIV infection. There are many organisms, bacteria, viruses, etc., which cause sexually transmitted infections. The difference, the linkage with HIV is that HIV is also sexually transmitted, which is why it kind of gets clubbed with these diseases. Having said that, HIV is a lifelong illness. It does not have a cure, although it does have treatment which makes a person productive. The other STIs usually come up with manifestations that are related to our private parts in terms of either discharge or discomfort or ulcerations or other issues, and they impact let us say the reproductive tract as well, in terms of having infertility or in terms of impacting the pregnancy outcome of people also. So, but STIs, which include diseases like syphilis, gonorrhea, chlamydia, etc., are treatable and there are commonly available antibiotics, a short course of which can completely cure the sexually transmitted infections.
Okay.
Unlike HIV, where you need lifelong treatment. So there is a relationship between the two infections, that somebody who is suffering from an STI is more likely to get HIV because it reflects his risk behavior. If someone has got an STI, it does reflect that perhaps there is a risk in his sexual acts. So if we were to treat STIs and if we were to address the risk, we would also lead to HIV prevention.
But the positive information is that STIs can be completely cured.
Absolutely.
And HIV, of course, needs treatment for a lifetime. But what are some of the symptoms of HIV then that can distinguish them from, let's say, the other STIs?
So HIV as an infection, once you get it, it might mimic a normal viral flu, flu-like illness, and a person might not even link it to his risk. So I would say that the initial phase of HIV largely goes unnoticed. The person may have fever, he may have malaise, he may have maybe some enlarged lymph nodes, or any illness that looks like a viral fever and may be treated like a viral fever. But HIV, when it starts impacting the immunity, and there are certain cells in our body which are called T cells, or these cells are responsible for developing good immunity to various infections. So when HIV causes these cells to come critically down in our body, then you may be making yourself at risk for developing tuberculosis, for developing any other infections, for developing certain kinds of viral infections which can affect any part of your body, and certain fungal infections. And these infections may manifest largely in any part of the body that they affect. Not necessarily just the genital tract or just the reproductive tract, but they could have impact on your eyesight, they could have impact on your lungs, they could have impact on your brain. And then these symptoms may highlight, if it is not detected early enough, then at this symptom only a person might come to know that he has HIV. And which is why we run interventions for people at risk and keep getting them tested regularly to detect this infection if their risk behavior continues. And that is what I would like to encourage the people who are watching this show to self-introspect and see if they are at risk. If they are taking drugs, they are sharing needles, or they are practicing unsafe sex, to definitely go and get tested, because HIV is not going to show up as a symptom. It may sit in your body and only show up when perhaps it is late to manage it.
Okay. We know that the government provides treatment for HIV, but what kind of help does government give to people who suffer from STIs?
Government provides treatment at centers which are known as Suraksha clinics, and these centers are run at medical colleges and district hospitals across the country in the government setup, where we provide free treatment in the form of color-coded drug kits. As I said, that we have many organisms that cause STI, but their symptom complexes are for ease of understanding divided into 7 syndromes, and for each syndrome the treatment is color coded and it is available through health system. It's even available at all the primary health care centers and the CHCs which are run and supported under the National Health Mission, and these drugs are required to be taken as prescribed, and once taken for a full course lead to complete treatment, and these are provided free of cost. And anyone who comes with an STI is also offered a test for syphilis and a test for HIV, along with counseling, condoms, and we give follow-up services also to make sure that person is fully treated.
So most of us are, drawn into cultural, let's say, influences, and we can see a lot of the icons today, they have tattoos. So a lot of youngsters are interested in getting tattoos done. Does that, are they likely to get infected if they, use perhaps needles that are not, let's say, clean? Yeah.
Exactly. So tattoos can increase our risk of getting HIV, hepatitis B and C, and the reason is, as you rightly said, use of equipment or use of the ink that is not clean. So, and youngsters
Even the
are
ink, even the ink.
So, youngsters are very attracted by tattoos, body piercings, and if these are not done at the right type of locations where people are scrupulous enough to use a fresh needle or a fresh bottle of ink when tattooing is happening, then it can potentially lead to HIV infection. And in fact, people who have been tattooed recently are debarred from donating blood for this very reason. They cannot donate blood for a period of 1 year from getting the tattoo, just to avoid even the slightest risk of transmission of infection due to these processes. And my message to the youngsters or even the not so young who are interested in tattooing and body piercing is that make sure to ask the provider that your needle is fresh and your ink is fresh.
So you mentioned body piercing as well. So I mean, people who get their ears pierced and all that are also prone to the same infections. Yes, if it is done
through an equipment which is being reused across multiple people, it can lead to transmission of infections, not just HIV but hepatitis too.
So since we're talking about needles, the question comes about mosquitoes, right? They also have needles and they spread other illnesses. Why don't they spread HIV?
So mosquitoes are not needles which are drawing blood from one human being and injecting it to another. So scientifically there is no proven instance of HIV transmission through mosquito bite, because the mosquito only draws blood from an individual which goes into its stomach, and when it bites another individual, it's not drawing out that blood and injecting it. So it does not, although it does appear like a needle, it does not cause any risk of transmission of HIV, but yes, it can carry dengue, it can carry malaria, it can carry Japanese encephalitis and many other vector-borne diseases that are spread through mosquitoes.
How concerned should people be about dating apps? Because here again we are talking about cultural shifts. People are now using these methods to interact with each other.
Dating apps, going on a dating app and looking at pictures or swiping right or left is not going to lead to HIV or any other infection. But people go to dating apps to network, to meet individuals, and then perhaps there is a lot of lingo of young people which I do not profess to be proficient in, but they could hook up and they could want to meet and then indulge in unsafe sex. So my message to people who use dating apps is, I would not say stop using dating apps, but use it responsibly. Enter into a relationship with full responsibility. And if you are going to have sex, then make sure that you have the prevention tool available with you, which is a condom. And learn to say no if there is insistence on condomless sex, especially in the casual spectrum of it.
So how should HIV be characterized? Because I mean now there's treatment available. Is it dangerous? Is it chronic? Is it lifestyle? How is it categorized?
We do not like using the term dangerous or life-threatening with HIV, primarily because it adds to the stigma and it adds to the fear attached to the illness. We like to use the word chronic manageable disease akin to other non-communicable diseases like hypertension, etc., only because we have seen in our program that we are retaining people on antiretroviral therapy with good lifestyle changes that these people have made in terms of having nutritious food, taking care of their health otherwise, making sure that they exercise or they get the necessary, I would say, stimulation, leading worthwhile lives, following a vocation, and leading near normal lives. So when it is possible that you can follow treatment regimens and lead good lives, then we would encourage the HIV, people who know their status, the people who know that they are infected with HIV, to come to our antiretroviral treatment centers, which we run under the program, and avail of free antiretroviral treatment.
Okay. Now you did mention earlier that in 2017 the government had brought in a law, the HIV AIDS Prevention and Control Act. what is the main purpose of this law? After all, HIV has been around for some time. We've always had this kind of treatment available. The law came in at 2017. Does it protect the rights, in fact, of people with HIV?
Right. So, HIV is a disease, but it is also a social construct, considering that there is a lot of stigma and discrimination attached to people who live with HIV, and also many people who are living with HIV have been part of designing HIV control programs. So, the Act actually provides an enabling provision to prevent stigma and discrimination in terms of a penal provision, and it also safeguards the rights of people who live with HIV in terms of their right to confidentiality. Nobody can, once they know the status of somebody, can propagate this status without the person's explicit consent. You cannot simply label a person as HIV positive and put a slip against his bedside in a hospital, or label a person as HIV positive on social media or anywhere, because this is not correct and not something that we want to be done. And in the HIV AIDS Act and rules, there are these guidelines to do with informed consent, guidelines to do with confidentiality, guidelines to do with how do we safeguard the rights of HIV positive individuals, and how do we perform the testing for HIV, what are the basic standards that one must adhere to if one is providing HIV testing even in a private sector. So, it was in fact asked as to why one particular disease requires a law, whereas stigma and discrimination has been also seen with leprosy and with even tuberculosis, and many times with other diseases as well.
Finally, as a doctor, what advice would you give people, once again, perhaps, a recap of some of the key points you've been talking over the last 20 plus minutes. People to, feel confident about themselves, to come out and go for the treatment, and also that, this is perhaps an illness that people can live with and live quite a decent life.
So, my message would be in two parts. One part being for those who think they could be at risk. So, if you think you could be at risk, the best way to deal with it is go and get tested. So, if you get tested, you are clear in terms of perhaps not testing positive, and maybe if you learn about the infection from the counselor who administers the test, in terms of whether you could be in a window period, and be able to modify your behavior in terms of preventing HIV transmission. And my second message is for society at large to consider the person living with HIV as another human being, and not judge him for behaviors or for just the fact that he is infected with this infection, because he is not at risk to you in any social interaction.
So, if there's any question that I've missed out, and perhaps people would like to ask questions on their own, where do they go now?
They call 1097 as a start, because that's as close as your mobile phone.
Yeah.
And the second is that the program runs many interventions both in the community and in the hospitals, and one could go and locate an ICTC or an ART center to meet the counselor there and understand what he wants to. But at first, I would say call 1097.
1097 is the number that people have to call. Dr. Shobini Rajan, thank you very much for joining us here on this special program and explaining to us what HIV AIDS are, also the other STIs, and what how people can actually come forward and be treated. The government is always open. There are helplines, and people can live a near normal life with dignity, and are mandated to live with dignity by law as well. Thank you very much for watching. Namaskar.
Thank you.
Voice of a rising aspirational world. Stories of challenges, struggles and accomplishment. A world battling conflict, hunger and poverty. Embracing growth, development, science and technology. A voice of